lecture concerns Chapter 1, Mental Health and Mental Illness. So before we begin, ask yourself a question and kind of ponder it. What does mental health mean to you? So our textbook actually discusses a movie scene. And it talks about, if you're a fan of vintage films, you may have witnessed a scene similar to this. A doctor wearing a lab coat, carrying a clipboard, and displaying an expression of deep concern enters a hospital waiting room. He approaches an obviously distraught gentleman seated there. The doctor says, "I'm afraid your wife has suffered a nervous breakdown." From that point on in the film, the woman's condition is only vaguely hinted at. The husband dutifully drives through the asylum gates and enters the stately building. Sounds of sobbing or shrieking patients are heard. Patients are rocking on the floor or shuffling down the hall. As he nears his wife's room, the staff regard him with sad expressions and keep a polite distance. He may find his wife laying in her bed, motionless, standing by the window and staring vacantly into the distance, or sitting with other patients in the hospital's garden. The viewer can only speculate about the actual nature of the woman's illness. I'm sure everybody in our room today has listened to, or not listened to, but watched movies or read books that portray some type of mental illness. Ask yourself how that has shaped what you expect things to be like. How's your perception been altered? Also notice they use the doctor said, "I'm afraid your wife has suffered a nervous breakdown." Are you familiar with that term, nervous breakdown? It is not the most accurate term that we can use. So first things first, unfortunately the mental health myths quiz is no longer available through the CDC, but we've watched some of the videos in class, and you're welcome to watch those as well independently. So do any of these statistics surprise you? Over 50 million Americans will experience a mental illness. 15% of adults had a substance abuse disorder just last year, and 93.5% of those did not receive treatment, and so on and so forth. We need to recognize that mental illness is such a common problem that it is likely you know someone with a disorder. But those disorders can be things like Alzheimer's disease, dementia, but then it can be the other side of that spectrum in things like depression, anxiety, and schizophrenia. So mental health is absolutely not, or health in general is not possible without good mental health. So the definition of mental health is a state of well-being in which individuals reach their own potential, cope with the normal stresses of life, work productively, and contribute to the community. The World Health Organization describes health as a state of complete physical, mental, and social well-being, and not merely the absence of disease and infirmity. There is a huge correlation between physical health and mental health because they're completely intertwined. Poor physical health can lead to mental distress and disorders, but conversely, poor mental health can also lead to poor physical health. So, again, what is mental health? Figure 1.1 on page 2 of your textbooks give you some of the attributes of mental health, which we're going to talk a little bit further in the next 3 slides. So mental health is foundational for our emotions and our emotional well-being, for thinking and learning, communication, resilience and self-esteem, as well as our overall daily functioning, as you can see here listed in figure 1.1. Again, the concept of mental health is vital to the ability to interact, think, and live a fulfilling life. So mentally healthy people, they can think rationally, they have good communication skills, they are resilient, and they have good self-esteem. And these are just a few examples. But the definition of mental illness evolves over time, and it's based on the norms and the values of the society and the culture that you live in. So think about your society and think about your cultural background. How has this influenced the way you think of mental health today? So let's talk a bit about the mental health continuum. We all exist somewhere on one of these continuums. Or actually, let's back up. Well, go back to slide 6. So mental illness does not occur from a single cause, but it results from a change in emotions, thinking, and or our behaviors. Mental illness is associated with distress and problems in daily functioning that affects a person's social and family relationships as well as work or school. And then factors associated with increased risk can include a traumatic life experience, substance abuse, loneliness, isolation, and biological or genetic issues. And then a mental health disorder is a diagnostic term for a group of mental illness manifestations, and here are several examples. So now, I apologize for that. Let's talk about the continuum. So again, we all exist somewhere on this continuum. Well, well-being, which is to the far left, well-being is characterized by adequate to high-level functioning. This person is at this end of the continuum. They may experience stress and discomfort resulting from problems of everyday life, but they experience no serious impairments in daily functioning. For example, you may be upset about failing an exam, but after a few days you bounce back and you function normally again. Mental illness is at the opposite end of the spectrum, or this continuum, and these people may have emotional problems or concerns and express mild to moderate discomfort and distress. There may also be some mild functional impairment like insomnia, lack of appetite. And problems in this mental illness category tend to be temporary, but for others it may fit into this group of people who will need professional help. This can be people with ADHD, generalized anxiety, and mild depression, just to name a few. But the most severely affected people also fall into that mental illness category. These people experience altered thinking, altered moods and behaviors, and they can include things like anxiety and depression, but they also can include things like schizophrenia. The difference here is that they are often chronic and long-term, with impairments ranging from moderate up to disabling. So there are risk factors for mental illness. Life course. These are the individual attributes and behaviors. These are things that we are born with, and they're things that we learn. There is exposure to physical, environmental, and socioeconomic events at critical stages throughout our life can have an impact on our mental health. These critical times include encountering and managing milestones, stages of rapid growth and development, and exposure to adverse childhood events, or ACEs. I really want you to narrow in on that ACEs because you're going to hear about those throughout the entire term. Some examples of life courses of biological risk factors include prenatal exposure to alcohol and drugs, or maybe oxygen deprivation at birth. Your genetics and your family history is also a heavy predictor under life course. So household, this includes the income, access to food and water, mental health of the parents, social support, and maternal care that's received. So what is a person's first social group in life? Your family plays a major role in development, in promoting confidence, and establishing good coping skills. Moving on to community, this includes neighborhood security and participation in community events for social connection. And then global relates to social determinants of health, which include human rights, access to health care, housing needs, policies for education access, governance, and inequality. Culture would also be included here under global, as different cultures have varying views of mental illnesses. So resilience is the ability and capacity to secure resources needed to support well-being. Now, this does not mean that the person is unaffected by stressors in life, but they are effective at regulating their thoughts and regulating their emotions. Resilience is characterized by optimism, a sense of mastery, as well as competence, and resilience is absolutely essential to recovery. Box 1.1 on page 4, I would like you to answer this privately and see just how resilient you are. So stigma. Stigma is a negative attitude or discredit against an individual group in which they are labeled as different. There are 3 types of stigma: public, self, and institutional. So public occurs when there is a negative attitude toward those who have a mental illness, which can be expressed in discriminatory attitudes or even actions. Then there's stigma of self. This occurs when an individual adopts a negative view or internalized shame about themselves or their condition and may see it as a flaw in their character. And then institutional stigma occurs when the governmental policies or organizations limit opportunities for those with mental illness. And then let's talk about bias. Bias includes stereotyping, prejudice, or discrimination against a group of people that in comparison to another group is unfair and usually results in unequitable treatment. 2 types include implicit and explicit. Implicit occurs when the bias is outside of one's conscious awareness, and explicit occurs intentionally by displaying behaviors or discrimination toward other people. So moving on to the diathesis stress model. This model looks at the biologic predisposition of a person, which is the diathesis, and environmental changes or trauma, which is stress, and it is the most accepted explanation for mental illness. The impact of nature plus nurture increases a person's risk for developing a mental health disorder. So social influences on mental health care. The decades of institutionalization, created political and social concerns that gave rise to the mental health movement of the 20th century. So first, the consumer movement in mental health recovery. This included promotion of patient consumer rights and recovery. Consumers were people with a mental illness and became advocates for their own rights. Under this movement is the National Alliance on Mental Illness, and it was formed in 1979 and advocated for consumers to be more involved in their care. The concept of recovery through a process of change to improve health and wellness. It was self-directed, and people were able to live, work, learn, and fully participate in their communities, thereby reaching their full potential. The 1990s were known as the decade of the brain. President Bush advanced neuroscience, brain research, and genetic testing during this time. Moving on to the Surgeon General's report on mental health, it stated that mental health is fundamental to overall health and there are effective treatments available. The Human Genome Project was a 13-year project which has aided in understanding the role of biology and genetics in psychiatric conditions. The President's new Freedom Commission on Mental Health. The goal is to alleviate fragmented care and use a streamlined approach. On page 7, if you'll refer to box 1.2, these were the goals of a transformed mental health system in the United States, and this comes from 2003. Goal 1, Americans understand that mental health is essential to overall health. Goal 2, mental health care is consumer and family driven. Goal 3, disparities in mental health services are eliminated. Goal 4, early mental health screening, assessment, and referral to services are common practice. Goal 5, excellent mental health care is delivered and research is accelerated. Goal 6, technology is used to access mental health care and information. So ask yourself, 22 years later, how many of those goals have we actually met? And then finally, the Institute of Medicine. It highlighted the gap between best and worst care. I want you on page 8 to review QSIN, Quality and Safety Education for Nurses, on your own. But just note that money for research has provided a deeper understanding on mental health disorders. So there's 3 legislation listed up here. The first is the Mental Health Parity Act, the second is Patient Protection and Affordable Care Act, and the last is Healthcare and Education Reconciliation Act. These key policies address insurance coverage for mental health. Despite this, problems continue with finding mental health professionals for care, with certain plans and limited coverage for some brand name drugs, especially your antipsychotics. Now, the Mental Health Parity Act, parity equals equivalence. This act required insurance companies to provide equal treatment coverage for psychiatric disorders, so they could not discriminate against mental health disorders. Your Patient Protection and Affordable Care Act, this is where coverage for most Americans through expanded Medicaid eligibility. There was also an insurance mandate for more coverage. And then Healthcare and Education Reconciliation Act is an addendum to the Patient Protection and Affordable Care Acts, which includes student loan reform. So epidemiology, as it relates to mental health, is the study of the distribution of mental health disorders. Clinical epidemiology is a broad field that examines health and illness at a population level. It's a study of the natural history of illnesses, diagnostic screening tests, and interventions that aid in identifying a link between psychological and physical symptoms such as depression and cardiovascular disease. Incidence is the number of cases in a given time period. Prevalence, number of cases regardless of when they began. And lifetime risk is the risk that one will develop a disease in the course of their lifetime. So let's talk a little bit about classification of mental disorders. You have 3 manuals that we're going to reference here. The first is the Diagnostic and Statistical Manual, DSM. We're on edition 5. It is the official medical guideline of the American Psychiatric Association for diagnosis of psychiatric disorders. It assists in using common diagnostic language to describe patients with mental health disorders, and it does not classify people, but it classifies their disorders. Nurses can use this tool to aid in planning, implementing, and evaluating patient care. And if you encounter a term that you are unfamiliar with as a nurse related to psychiatry, the DSM-5 is where you'll want to go to look that up. Next, you have the International Classification of Diseases, 10th edition, ICD-10. It is a global resource to the DSM-5 with clinical descriptions of mental and behavior disorders. There are 2 broad classifications in it, and it includes psychosis and neurotic with subclassifications of each. And finally, you have your ICNP. It was developed by the International Council of Nurses to provide standardized nursing diagnoses. So psychiatric mental health nursing, it promotes mental health through assessment, diagnosis, and treatment of behavioral and mental disorders. It uses nursing, psychosocial, and neurobiological theories and research. And we work with people throughout the lifespan. Psychiatric mental health nursing is employed in a variety of settings among varied populations, and you should remember that we work with patients who are in a crisis every day, not just in mental health facilities, but you're going to see them on med-surg floors, labor and delivery, the emergency department, doctor's offices, etc. So the basic level mental health registered nurse must have 2 years of full-time work in mental health, 2,000 clinical hours, 30 hours of continuing education, followed by taking a certification exam to add that BC, which means board certified, to their RN title. And then you have your advanced practice. These are psychiatric mental health advanced practice registered nurses, so think nurse practitioners, but for mental health. And finally, trends affecting the future. There's educational challenges because there is less time, and specialty training with clinical rotations is becoming more difficult to obtain. So you're getting your degrees faster, and there's just not the clinical sites to go to. There's an increasing demand. The number of patients needing psychiatric care has outgrown the number of available healthcare workers. We also have an aging population. We have increased numbers with dementia that require more inpatient settings. We also have cultural diversity. So we need competency with sensitivity to different cultural views regarding health, illness, and their response to treatment. And with cultural diversity, we can also throw in their cultural competence. And this is where nurses adjust their practices to meet the patient's cultural beliefs, the patient's practices, needs, and preferences. And then finally, science, technology, and electronic health care. Genetic mapping that we will talk about very, very briefly in a future chapter can actually help identify individuals that are at risk and help target the appropriate medications for their use. And then telemedicine, it is dramatically increased in all areas of healthcare, but especially in mental health practice. And finally, you could read through your knowledge checks. A family has a long history of conflicted relationships among the members. Which family members comment best reflects a mentally healthy perspective? And the correct answer is C. I will make some changes in my behavior for the good of the family. And finally, which individual behavior demonstrates resilience? The correct answer is D. Taking a temporary job to maintain financial stability after loss of a permanent job.